Hello all, myself Dr. Kiran. I've done my BNYs, Bachelor's of Naturopathy Medicine and Yogic Sciences from SUASA University. Today I would be talking about a few yogic breathings and pranayama techniques for COVID-19 pandemics, especially for the people who are affected with COVID-19. So there will be two parts in the session. First part will deal with breathing exercises, and second part will deal with the pranayama practices. Even in the second part, we will have again two parts. First one will be dynamic breathworks, which are to be avoided for people with a lot of breathing difficulty and those who have very less oxygen level below 95 we can consider. And the second part will have the calming, balancing and cooling pranayamas, which will be good for all the people, and those will be generalized practice for everybody. Okay, so let's get started. Sit in any comfortable meditative posture. Here I am adopting Ardha Siddhasana. Left heel in, right heel out. Both hands over the knees. Let your eyes be closed. Observe your breath. You open up your eyes. And let's get started with very simple technique. This is called as side stretch breathing exercise. In this practice, spread your hands in line with your shoulders, palms facing the floor. As you inhale, lift up your trunk. As you exhale, bend towards your right side. Place your right elbow down, right hand down, left arm over your left ear. Okay? Inhale up, exhale, change the side. Inhale up, exhale, opposite side. Inhale up, exhale, change. Inhale up, exhale, change. Make sure that your hand is pointing sideward. You are feeling the stretch at your sides, and do not drop your shoulders down. Okay, keep your both shoulders in one line. Okay, feel the stretch and push your knees down. This is very important, to push your knees down. Okay, again inhale, come up, exhale, change the side. Very slowly come up, release and relax. So for this exercise, you can go for 10 to 20 rounds of this exercise. This is good for sides also, and this is good for your lungs also to improve the capacity. It stretches the sides of your lungs, and that's how it works. Okay. Next is hand stretch breathing exercise. We will have 3 levels of hand stretches. One in 90 degree, other one at 135 degree, and lastly at 180 degree. Okay. So for this practice, interlock your fingers, keep your hands over your chest, keep your eyes closed. As you inhale, turn your palms out, straighten your elbows forward and feel this stretch at your back. Inhale and stretch your hands forward. Exhale, hands back over your chest. Inhale, turn your palms out and stretch your hands forward. Exhale, hands over your chest. Third round, inhale, stretch forward. Exhale, over your chest. Let's go for the second level of practice, wherein inhale and take your hands in 135 degree, diagonal to your forehead. Okay? Exhale, hands down over your chest. Once again, inhale, hands diagonal to your forehead. Exhale, hands down over your chest. Last round, inhale, up, hands up. Exhale, hands over your chest. Now stretch your hands completely up. Inhale and stretch up as you can. Exhale, down. Second round. Inhale, up, stretch up. Exhale, down. Last round. Inhale, stretch up. Turn your palms up and stretch up your hands. Exhale, down. Now let us go for Shashankasana breathing practice, wherein we will be adopting Vajrasana. So first stretch your legs forward, then flex your right leg at knee and place your right heel under your right hip. Flex your left leg at knee and place your left heel under your left hip. If you are not able to adopt this posture, then you can sit in any crossed leg position, any meditative posture. Okay, no problem. Take your hands at back. Catch hold of your right wrist with left hand. Inhale, roll your shoulders back, expand your chest. Look up, extend your head and neck up. Exhale, bend forward. Try to drop your head down. Okay? As you inhale, come up. Look up. Exhale, bend forward. Inhale, come up, stretch up. Exhale, bend forward. Inhale, come up, stretch up. Now, we will go for Makara chanting. So, bend forward and we will chant Makara, okay? Exhale, bend forward and chant Makara while bending. So take your hands at back again. Inhale, roll your shoulders back, expand your chest. Exhale, chant Makara and bend forward. Once again, inhale, come up. Last round, inhale and up, stretch up. Slowly come up, release and relax. Okay. Now let's go for the second part of this session. This is pranayama techniques. So before we start any pranayama, we go for cleansing technique. So in this, we will go for Kapalbhati Kriya. Kapalbhati is also considered as a cleansing technique. So Kapalbhati is active exhalation followed by passive inhalation. So with this technique, now we will go for the second part of the session, that is pranayama practices. And before we start pranayama, we go for cleansing technique. So here we will do Kapalbhati first. Kapalbhati is a kriya, it's a cleansing technique in which we exhale out forcefully. Okay, inhalation is passive, inhalation is natural, exhalation is forceful. Now we have got little modification in Kapalbhati kriya. So we will do nostril specific Kapalbhati kriya. So first we will do Kapalbhati with right nostril, then we will do Kapalbhati with left nostril, then we'll do Kapalbhati with both the nostrils. Okay. So let's go for these three variations of Kapalbhati. First with right, then with left, and then with both the nostrils. Okay. Again, sit straight, adopt any comfortable meditative posture. Adopt Nasika Mudra of your hand, first and second finger folded at the root of thumb. Close your left nostril with last two fingers. Inhale and exhale forcefully with your right side. Again, I will mention it here. People who have a lot of breathing difficulties, do not go for this practice. You have got the second part to do and the earlier one wherein we covered breathing exercises. But this part, which is dynamic breathwork part, this is for the people who do not have much of breathing difficulties. Their oxygen level is in between 95 to 99. So for them, we can go for such practices. Okay. So let's start, and we will go for just 30 strokes with right nostril. Start the practice. Once you are done, then please stop the practice. Observe your breath. Feel the difference between your right side and left side. Now let's start the same practice with opposite side. Again adopt Nasika Mudra, first and second finger folded. Close your right nostril with thumb. Let your left nostril be open. Exhale out forcefully through your left. Okay. Let your eyes be closed. Start the practice. 30 strokes. Okay. 25 to 30. Start. Observe this amazing feeling. You may find you are not at all breathing for a few seconds. Try to observe your breath. Try to observe the difference between left and right side. Now let's balance both the nostrils by practicing Kapalbhati Kriya with both the nostrils. Okay? So for that, again, keep your hands over your knees. Sit straight, let your eyes be closed, and we will go for just 40 to 50 strokes of Kapalbhati with both the nostrils. Usually when you practice Kapalbhati, you can go for 3 rounds of Kapalbhati Kriya, okay? But in this session we will cover only 1 round, but when you are doing by yourself, try to cover for 3 rounds, okay? With 30 strokes. And then you can improvise, you can increase the counts. From 30 you can go to 40, from 40 you can go to 50, 60 likewise. Maximum counts that you can, or maximum strokes that you can cover in 1 round is 70 to 80. Do not go beyond that, or you have to do it very cautiously because breathing is very natural process and we are trying to manipulate the breathing. So here we have to be a little cautious when we do dynamic breathworks, when we manipulate the breathing in a little dynamic way. So we cannot do it for longer time, we cannot overdo it actually. So we have to be a moderate practitioner of such practices, okay? Let's start with Kapalbhati with both the nostrils. Let your eyes be closed. Exhale out forcefully. Observe your breath, an amazing feeling of stability of the body and stability of the breath. Try to observe your mind as well. You may find your mind and breath are synchronizing. Slowly and gently, once you come back to your normal breathing, open up your eyes and prepare yourself for the next dynamic breath work. We will go for Bhastrika Pranayama. So in Bhastrika Pranayama, there are two techniques. One is with hand movements, other one is without hand movements. Okay. So the one with hand movements, for this, as you inhale, you will spread your fingers and take your hands up. As you exhale, make fists of your hands and drag them to the shoulder line. Okay, inhale, exhale, inhale, exhale. While pushing your hands up, spread your fingers. Okay, this is the technique. So we will go for one big round of Bhastrika Pranayama. Let's count for 35 to 40 strokes. And then we will go for the Bhastrika without hand movements, and for that we will reduce our stroke number. Okay, start the practice. Try to observe your breath. Try to feel this amazing energy all around your body. Now slowly and gently open up your eyes. Now the difference between Kapalbhati and Bhastrika is, in Bhastrika you inhale deeply, you inhale forcefully and you exhale forcefully. Okay, Kapalbhati you just exhale forcefully, but in Bhastrika inhalation and exhalation both are forceful. The same practice without hand movements. Keep your hands over your knees and we will go for just 15 strokes, not more than that. Inhale and exhale forcefully through both the nostrils. Okay, start the practice. Let your eyes be closed. Observe your mind and observe your breath. Slowly and gently open up your eyes. Now let us go for the second part of pranayama technique here. So we will go for alternate nostril breathing. We will go for Bhramari pranayam, wherein we will be chanting Mokar, and we will also go for sectional breathing. So let's start with sectional breathing first. In sectional breathing, we have 3 lobes of lungs, and we will try to utilize all of them by going for abdominal breathing, by using your chest, by using your shoulders. Okay, so first we will go for abdominal breathing. So in this, keep your hands over your knees. You can adopt chin mudra throughout the practice. Keep your hands over your knees. Let your eyes be closed. As you inhale, try to bulge up your abdomen, expand your stomach. As you exhale, relax your abdomen. Inhale and expand your abdomen. Exhale and relax. Again, inhale and expand your abdomen. Exhale and relax. Last round, inhale and expand your abdomen. Exhale and relax. Now let us go for chest breathing for 3 rounds. Inhale and expand your chest. Exhale and relax. Inhale and expand your chest. Exhale and relax. Last round. Inhale and expand your chest. Exhale and relax. Let's go for shoulder breathing. Inhale and shrug up your shoulders. Exhale and relax. Inhale, shoulders up. Exhale, relax. Inhale and breathe in till your breath comes to the throat. Exhale and relax. Gently stop the practice. Here again in the practice I have taken only 3 rounds of abdominal breath, 3 rounds of thoracic breath and 3 rounds of shoulder breathing. But you can go for 5 rounds, you can extend it to 9 rounds. Okay, so this is going to improve your lung capacity. This is going to exercise your lungs in all the ways. It is going to use all the parts of your lungs. Okay. Now next we will go for Anulom Vilom Pranayama. So in this pranayama technique, you will have to adopt Nasika Mudra. First and second finger folded at the root of thumb. We will go for inhalation with one nostril, exhalation with other. Inhalation through same nostril, exhalation with the earlier nostril. Okay. So the technique is very simple. It's just alternate breathing by using your alternate nostrils. Okay. So close your right nostril with now. Inhale through your left. Close your left nostril with last 2 fingers. Exhale through your right. Inhale through your right. Exhale through left. Inhale through left. Exhale through right. Inhale through right. Exhale through left. Inhale through left. Exhale to right. Inhale through right. Exhale through left. Last round. Inhale through left. Exhale through right. Inhale through right. Exhale through left. Slowly and gently stop the practice. Observe your breath. For that, press your ear tragus or flaps to your thumbs and put rest of the 4 fingers over your eyes. Inhale deeply and exhale by chanting Makara with closed lips. Okay. So we will go for 5 rounds here, but you can practice for 9 rounds and 27 rounds. Okay, this is a very important, very good pranayama to recover the body, to heal the damaged tissue, and also to improve lung capacity. Okay, so let's get started. Close your ears and eyes. Inhale deeply. Slowly and gently release your hands. Feel the vibrations of Mokara chanting. Observe your mind and observe your breath. Slowly and gently join your palms together. Adopt Namaskar Mudra of your hands. Inhale deeply. Let's conclude today's pranayama session with one Omkara 3 Shantis. Om Shanti Shanti Shanti. Rub your palms. Please remove your eyes and transfer the warmth and energy. Again, rub your palms and spread the energy all over your body. Slowly and gently open up your eyes. Thank you all. Thank you for listening to me. So, these practices are very good. They are very evident in improving lung capacity. They are very good to improve your oxygen level in the blood. So first part wherein we dealt with exercises, breathing exercises, it is good to go with all of us except those who have severe back pain, so they can avoid side stretch breathing practice. Those who have cardiac problems, hypertension, that is high blood pressure, so for them the dynamic breathwork part is to be avoided. And the last part, which we dealt with, the very cooling and calming techniques of pranayama and balancing pranayama, can be done by everybody. Actually, there is no contraindications for this pranayama, the last way which we did. Okay, so all the best. Have a nice time and stay safe, stay home. Thank you all.